Okay, so we finish up our physical exam on this patient. We want to go into our assessment and plan. And as you come in, you notice a couple of things. Number one, it kind of defaults to the patient problem list here. That way, if it's kind of a chronic illness, we can just very quickly select our diagnosis here. Down below is our current plans. This is what we want to add to. And then future plans would be things that we want to do in the future. For example, if we order a procedure and it's scheduled in the future, it's going to move over to this side for us. So when we start here, we can start, if it's a chronic illness, we can simply click on. For example, if this patient's hepatitis B is what we're dealing with, we can click on there. If we have something down here that's we need to remove, just simply highlight it and you can remove it. But the way we want to think about this is think about diagnosis first, then what you do related to the diagnosis. So we can do a couple ways. We could search, and we can search several different resources here as far as type of laboratory, CPTs, diagnosis, discharge, office procedures, quite a bit. But most patients we want to be able to start on short list here. And this is what we've already populated. You notice it's broke down by specialty. So let's say this patient's primarily internal medicine. And you'll see a couple things here. You see encounter form ICD-9. This is all the encounter form diagnosis that we've had, we've taken and put in here for you. So if it was on the encounter form, it's here for you to find. So let's just say the patient has a musculoskeletal diagnosis. As we pull up, these are the ones we all should be familiar with. And we'll say this patient, for example, has neck pain or cervicalgia. So we add that in, and then we say, okay, we want to do a procedure related to that. So we want to do some imaging, and we're just going to say, for example, we want to do an x-ray. And again, we expand that, and you can see these should be very familiar for you. And when we look here, the x-ray here, we actually want to look for a spine or cervical series. And here's our neck spine here. So we double click that, and you notice that applies to that diagnosis. So that's the way we want to work things. So for those acute problems, that's going to be something that you want to kind of learn how to navigate around. But say if we have a patient that we see a lot, or a diagnosis that we see a lot, what we've done is we've set up protocols, and we're just starting to do these. So for example, if they're diabetic, we have the diagnosis here. And if you expand this, what you see is underneath what that triggers. So for a diabetic patient, very routinely what we're going to do is we're going to check blood work. We're going to get a glucose, a finger stick. We're going to usually do a CMP and a hemoglobin A1C. And then we're typically going to follow them up in 3 months. So instead of going to hunt all that, all we have to do is double click. And we're just going to say yes there. So you can see what's happened is now that diagnosis is here, plus all those things that we would normally order. So instead of going and having to find each piece, those protocols let us do that very quickly. Again, this is the short list. This is what we populated for everybody, and then you can customize this into your short list, okay? And again, the way you would do this is basically highlight that and then click on Add to My Short List to move it over. So this is something we'll work with you to customize more. So say we've figured out that, and we can't find a diagnosis. Just for example, let's say hypertension, even though I know it's in there, just so you can see how to search things. And when we look here, we see several hypertensions. We're going to say this is the benign. And then we want to add a medication here, and we want to refill a patient medication. So we go to the patient's medicine. We see the patient's taking Norvasc. So we double click that to refill it, and that comes down here. Once we're complete with it, it'll pop up a box. I'm going to go ahead and do that just to show you what it generates. And this way you put in the details. This is something we'll customize to each of us as far as what our most common things are. If you give 30 days at a time or you prefer 90 days, we'll put this here. Also, if you notice down here, interactions as far as things as far as with food or other medications will show up. And then if you remember back in previous videos, we put a note on this medication, and that's prefer this medicine gets 90-day orders. So that's something that reminds us. If we ever need to just quickly look at patient allergies, we can click here. The other thing is if there's formulary alternatives, what we'll see is these will be populated in this area. And for example, Norvasc here, it's obviously suggesting that we could use a generic with things. So that's something, if we wanted to do that, we could simply come over here and swap on that. And then when we're done with this, we'll set up to where it will either print, go electronically, or be faxed, or you can change it here by selecting output. And of course, it's not going to let me do that because I haven't put all the information in there. Also, you'll notice you can tab back and forth between mail order prescription and local pharmacy. So these are the ways that we'll generate prescriptions in this system. And I'm just going to cancel out of here. And let's say that this is something that follow-up we want to set up here. So that note's going to be printed out, and that's going to go to the station secretary, who's going to say, okay, 3 months is what the provider wants, and then she'll process that. Let's say that we wanted to move a procedure or lab to the future. Otherwise, let's say, for example, this patient didn't have time to get their hemoglobin A1C done. So you'll notice right now it's ordered for today, but if we come in here, we can say, okay, they're going to come back on Friday and do that. So let's go ahead and move that out. Now you notice what's happened is that procedure is now going from today's plan to the future. So what will happen is, billing-wise, nothing will happen until that event is done. And this will be the same for ordering colonoscopies and so forth, in that when it's scheduled, it move into future plans here. So that's how we do the assessment plan.